This is a 30-minute video on substance abuse and addiction, and this video will be followed by a 50-minute video where I'm speaking with a law enforcement officer who is sober now and in recovery from alcohol addiction. So let's start off though with some of the basics. What is addiction? So addiction, a definition that I like to use is continued compulsive use of a drug or behavior despite harm to self and or others. And a lot of the information I'm going to give you here in this half hour is from a book called Dopamine Nation. And it's a really good one. If you want to look more into some of these issues, it is a great read. So addiction is about 50% genetic. Even if you were raised away from the home of the family members who are addicted. So for instance, if a person is adopted or in foster care, didn't grow up with the parents who have addiction and are actively addicted, there's still about a 50% chance that they will carry that addiction tendency. So it isn't just environmental, it certainly has a strong genetic component. Trauma exposure increases addiction risk. It, of course, doesn't mean that it's necessarily going to happen, it just increases the risk, as does access to any particular substance or behavior. So alcohol is, of course, freely accessible and legal, and so it is one of the most highly abused drugs and that people are addicted to. Addiction includes addiction to alcohol, drugs, gambling, sex, shopping, food, relationships, work, Facebook, news, gaming, texting, YouTube, you name it. Really anything a person can be addicted to. There are, of course, different substances and behaviors that are more addictive than others. But the idea I want to make sure to get across here is that the human brain is wired in a way that we are susceptible to addiction. I will explain why. And really, we can be susceptible to any behavior or substance to be addicted to it. I'll explain why. So you might think about what you might be addicted to. Some of the criteria for determining if somebody has an addiction is, is it something that you feel like you need to do first thing in the morning? Has anybody asked you to stop doing it? Is it causing any problems for you? And we can probably all say yes to all of those just regarding our phone use. So our smartphones are extremely addictive little devices because of dopamine. So addiction works because of the neurotransmitter I just mentioned, which is dopamine. And dopamine plays an important role in motivation, excitement, and the pursuit of pleasure. So dopamine isn't actually about achieving whatever you are motivated for or excited about. It's actually much more about the pursuit of it. And because we're pursuing something that we are seeking pleasure in, it helps provide that motivation and excitement for it. So this is why law enforcement can be exciting, especially in the earlier years, even if nothing very exciting necessarily happens. It's just the possibility of it, the pursuit of it, the readiness for it. And that can drive the motivation for it and then the excitement about it. Later on, when the dopamine system is maybe worn out or overdrawn or circumstances change, what used to be exciting can later on become anxiety provoking, or it can be that there really isn't a sense of excitement anymore from the same things that used to cause excitement. The more dopamine a drug releases in the brain's reward pathway, and the faster it releases it, the more addictive the drug. So for instance, a drug like meth is going to release more in the brain's reward pathway, and it's going to release it faster than another drug, which is going to cause it to be more addictive than something else. So for example, chocolate causes a 55% increase in dopamine release. Sex causes a 100% increase, and then amphetamines cause a 1000% increase. So in between there is nicotine, which is 150%, cocaine is 225%, but as you can see, amphetamines are way up there as far as this range of substances. So we are, though, definitely also talking about behaviors. Some people are addicted to behaviors. So a work addiction is somewhat like a behavior addiction. It will give that same dopamine release, the seeking of whatever it is about work that a person finds pleasurable. For some people, they are addicted to making money or the excitement of it, or whatever it may be. There's some sort of pleasure pathway that's being fulfilled by any kind of behavior that it is. So in our brains, we have a pleasure and pain balance. Our brain is always kind of wanting equilibrium or homeostasis between pleasure and pain. And so our brain actually doesn't want too much pleasure. Of course, it doesn't want too much pain, but whenever there is a large amount of pleasure, it's actually going to offset that. And so the idea of what goes up must come down is really true here. Tolerance is an important aspect of addiction. Repeated exposure to same or similar pleasure stimulus gives us less pleasure over time, and it takes more of that stimulus while the after response to the side of pain gets stronger and longer. So for example, the more somebody drinks alcohol, the less pleasure they get from it, and the more alcohol it takes to get any pleasure, while the after effects or the withdrawal symptoms on the pain side get stronger and longer. So even if somebody isn't having physical withdrawals from not drinking, there's always some sort of pain trade-off. When you enjoy the pleasure side of any substance or behavior, you will also pay for it in the after effects on the pain side. So tolerance is really otherwise known as a neuroadaptation. So we need more of it, the drug or the behavior, to get the same effect. And this is why when somebody is addicted, it is quite often that they will continue to have more and more problems, need more and more alcohol, and it will take more and more to get the same feeling that they seek, and then the consequences can stack up. Can of course become more and more dangerous as time goes on for whatever substance or behavior they are engaging in, and then whatever they are engaging in is usually to the detriment of other healthier behaviors around them, and so there's kind of a cascading effect. Tolerance is needing more of a substance or behavior to feel the same effect. Over time, we feel less pleasure and pain increases. This is why a pain medication will not only stop working over time, but the pain can actually increase due to increased sensitivity to pain. So for someone who maybe unfortunately was prescribed painkillers back in the day before there was strong awareness about just how incredibly addictive they are, within 2 weeks, a person can be physically addicted to a prescription painkiller. Even if you're taking it as prescribed, you will be physically addicted after 2 weeks. And so the problem is that over time, that pain medication will not only stop working, but your sensitivity to pain will actually increase. So you may not even get a high anymore, but if you don't take that drug, you're miserable. So this is why you see people who are addicted to meth or alcohol or any other drug, frankly, and or behavior, and they are looking to feel something. They may be taking even fatal amounts of it, but not getting the high anymore or the good feeling that they seek. Yet they can't stop taking it because otherwise they would be buried in how miserable they feel without it. So there really is a dangerous piece to addiction. Some of the symptoms of withdrawal. So withdrawal is, of course, the period after somebody comes down from the high of the substance or behavior use. Symptoms of withdrawal are anxiety, irritability, insomnia, and dysphoria. So dysphoria is a state of unease or general dissatisfaction with life. Of course, withdrawal symptoms can be much more severe physically than this. In some cases, other medications are needed to lessen or make the symptoms of withdrawal tolerable or even not life-threatening. And so there are some medications or substances people are addicted to that they can't just stop cold turkey. They have to be medically detoxed. So that is an even more severe aspect of withdrawal. Over time, we can regain a state of balance in our brains. So our brains are absolutely damaged by addiction, but it's not like they are forever damaged. It takes at least about 5 years for the brain to start to really make some significant repairs. And the actual dopamine system itself and the pleasure and pain pathways need to repair. And it's very difficult to do. It takes plenty of support to truly do it well, but it is possible. So once you are back in balance, you can enjoy the simple pleasures in life again, which is something that's lost as addiction picks up speed. People start to lose the ability to enjoy things that they used to enjoy in life. And then essentially, it's sort of like tunnel vision, where over time, everything gets cut out except for that one thing, substance or behavior that they are addicted to and totally focused on. So we're going to talk about alcohol use in particular. For law enforcement, there is about a 25% statistic that about 25% of law enforcement abuse or are addicted to alcohol, and that's actual alcohol dependence. So I would say that about half of that, from my work, just anecdotally, half of those who are dependent on alcohol are have less of like the genetic makeup for it, or like that it's really truly primarily the core issue that's going on. About half are really seriously overusing alcohol as a way to cope with trauma. And so it's about half and half the way that that 25% breaks down. So even still, if it was say 17 or 18% who have alcoholism, that's still a plenty big number. And then even if the other half are abusing significantly alcohol, that's a problem as well. So we'll start with this. Of course, there are absolutely officers who are abusing other substances, painkillers, drugs, behaviors, whatever that may be. But we'll focus here on alcohol for a minute. So alcohol is a central nervous system depressant. It's rapidly absorbed from the stomach and small intestines into the bloodstream. And just a side note there, this is why it's so important to have food in your stomach, a meal in your stomach before you take your first drink. You're going to have a very different experience. Your whole system will have a very different experience, a healthier experience, if you do have food in your stomach when you take that first drink. Alcohol is metabolized in the liver. However, it can only metabolize a small amount at a time. So the liver can only take in so much. And what it can't metabolize is left to circulate through the body. And the intensity of the effect of alcohol on the body is directly related to the amount consumed. So however much you drink in whatever amount of time is going to determine how intoxicated you are. So what is a drink? We say a drink or a couple of drinks or whatnot all the time. A drink is actually 12 ounces of beer, which has a 5% alcohol content, or 8 ounces of malt liquor with a 7% alcohol content, 5 ounces of wine, which has a 12% alcohol content, 1.5 ounces or a shot of 80 proof, 40% alcohol content, or distilled spirits or liquor, such as gin, rum, vodka, or whiskey. So I know that you all know a lot about this already. It's of course illegal to drink and drive. And so I know that you have a lot of awareness about alcohol and the effects on the body. So I won't go into it too crazy in depth, but I am asking you to think about it, of course, at this time in particular to yourself and to your peers. So alcohol use standards, there is a change coming to these standards. These are the CDC standards, but doctors' research is showing us that these are actually needing to be lowered. So at the moment, drinking moderately means 2 or less quote unquote drinks in one day for males and 1 or less drinks in one day for females. And this is actually going to be going down. Binge drinking is 5 or more drinks within about 2 hours for men and 4 or more drinks within about 2 hours for women. And then heavy drinking would be 15 drinks or more per week for men and 8 drinks or more per week for women. So like I said, the standards are going to be changing, and especially in regards to health. So the effects on health for men and women, we now know these numbers need to go down for, kind of a recommended amount to stay under. I believe it's going to end up being less than 2 drinks for males and less than 1 full drink a day for females, which of course has an average out in a week and whatnot. So here are some things to consider. I think it's important to know if you're thinking about yourself or a family member or a peer, a colleague. Is there a problem with alcohol or with another substance or with a behavior? These are some questions to have in mind that are indicators that there might be a problem. So has someone told you that they think you have a problem? This is an important one. Others often notice the effects of an addiction before the person themselves who is addicted will notice anything. So you'll hear about this in the video next from Scott, and you will hear about how others were telling him what they were noticing. And it often takes a long time for a person who has addiction to hear what others are saying to them about their alcohol use or whatever substance or behavior it is. So part of the deal with addiction is that the main goal for the addicted brain is to receive more of the substance or behavior. And a person will do just about anything it takes to get more, to have more, for them to not be caught. And so this can lead to all kinds of really dysfunctional behaviors like lying and hiding the substance or the behavior. But there, of course, can be really massive consequences for it, that somehow the pleasure of the substance or behavior still outweighs how much pain it causes on the consequence end. But it really often very much just comes down to at what point does it become more painful to continue using the substance or behavior than it does to stop. And so some people can have better insight and awareness of those around them. It's often others who are being severely hurt by their use, but also, of course, the person using is hurting themselves as well. So there is, some would say alcohol or drug abuse or addiction is sort of a victimless crime. There is, though, a family component to addiction, and of course, there are all kinds of consequences that surround it. So, not that it is a crime. Of course, the behaviors that some people have when they are using their substance or behavior, some of the behaviors are criminal. If we're talking about um, a sex addict who's using prostitutes, or somebody who's drinking and then driving while drunk, any of those things, of course. Um, but even without that, there are certainly those who suffer around the person. It's not just the one person who's using that just suffers. So you may run into scenarios with peers who are struggling with addiction, and it may be their loved ones who are reaching out, or who you are trying to support and guide them in taking care of themselves while their loved one is struggling with addiction. The next question here to ask yourself or think about in relation to a peer is, have you ever been annoyed by someone asking you to do something less? Like, I need you to drink less alcohol, or I need you to, whatever it may be, whatever that behavior might be. Gambling is an example. Do you hide any of your behaviors or uses from others? This is another sign. This has to do as well with guilt and shame. Guilt and shame are very primary emotions related to addiction. A person will often feel very guilty or shameful about their use, or generally about themselves, which causes them to use. And then it often will just further that cycle of using and then feeling badly about themselves because of the use, and even more so, more guilt or shame than they felt before, which then causes them to use in order to feel differently. So the basis of alcohol abuse or addiction is when a person wants to change how they feel. It's, of course, sort of a need for immediate gratification, wanting to quickly have a substance-induced altered emotional state or physical state, or both. The way that alcohol sedates the system is sort of a quick, quote unquote, fix for stress, say, or for trying to avoid feelings, or it may be the only way that a person really can loosen up and feel much. And so that desire to change the way that you feel is usually what drives someone to drink or use or have behaviors that then become addictions. Do you ever find yourself thinking about or needing a substance or behavior after waking up for the day? And so this question is about how much is your body dependent on it? So that's why I mentioned our phone use. It's often the first thing we turn over and look at in the morning, because we think there's something on that screen that is going to have some sort of emotional content for us. And so we are seeking to change the way that we feel or look to it for some sort of pleasure reward aspect. And we just continually do that all day. So that's the dopamine reward system in full swing. And then throughout the day, we use it as well, right? And if we ever can't find our phone or we don't have it, we can feel panicky or agitated and strangely disconnected without it. When in reality, somehow humanity got along for a very long time without these little devices, and we did just fine. So there's also the way that technology and apps and news and everything else is presented to us is done so in a very addictive way. So it's done so in a way that grabs our attention and causes us to want more. And so that's sometimes for the better and sometimes for the worse. There are, of course, good ways to use technology on our smartphones, but it's good to just recognize that we are likely already sucked into that dopamine loop. You can also be addicted to things that don't have such consequences like meth does. You could be addicted to reading, or you could be addicted to some hobby or nerding out on something that you enjoy. And so there are all different kinds of things that the human brain can seek pleasure from, and then truly have an addiction to, and feel withdrawals without it, and need more and more of it to feel good. It doesn't have to be anything as destructive as alcohol or drugs or gambling or sex or things like that. So the last thing I want to make sure to mention here, you're going to hear Scott, who is an active law enforcement officer. You're going to hear him speak about his experiences with addiction. That's going to be your next video you'll see on your list. But I want to mention a couple things first. Addiction is truly a family disease. So I want to make sure that when you know you're working with a peer who has addiction or some level of alcohol abuse, whether it's dependency or not, you may not be sure, and that's okay, but there's always a family component to it. So the interesting thing about it is it's an incredibly difficult thing for a family member to not end up enabling the person who is addicted by their own behaviors. So any person who is experiencing addiction, if they have a wife or a husband or kids or a family, they likely need a lot of support as well, and can't be ignored, because there is the family component that usually involves codependency and an over reliance on trying to help the person, trying to soften the consequences on the person, or increasing guilt and shame about the use or the behavior. And all of these things really just sort of play into the whole dynamic of addiction. They're very normal and natural to get caught up in, but are not necessarily helpful. And what can end up happening is the loved ones can become so obsessed essentially with trying to fix or control the problem of alcoholism that they lose sight of taking care of themselves. And so this can, the whole dynamic, including the lack of self-care, can really lead to incredible levels of hurt and resentment and whatnot. So this family component is really important to pay attention to. If you are speaking to the spouse or the significant other of someone who has an addiction or a substance or behavior abuse problem, it's really important to help them focus back on themselves. So I really mean it when I say a family member of an addict can become so wrapped up in focusing on the addiction and lose sight of themselves. It can become all they think about, and it can essentially take both people or the whole family really down far down that dark hole. And doesn't have to go that way. It's really about boundaries, acknowledging that there's a problem and then staying in your own lane, having really solid boundaries, not saving the addicted person from their own consequences, because that is part of enabling, and taking extra good care of yourself, just like you would need to if a loved one had any chronic illness of the physical type. Same thing with any kind of mental health condition, such as addiction, which of course can have its physical addictive component to it, but essentially there needs to be a huge amount of self-care there and support for the family. So those are the main points. There are treatment options around the United States, specifically for first responders. And so those are usually some of the best ways to go for an inpatient stay. We are lucky to have Hazelton here in Minnesota for inpatient. and I've heard the vast majority of feedback with that program as positive. They do have a family program that's included in with any inpatient stay. It's a few days long, like daytime programming. And then there's intensive outpatient addiction programming. The very first step for somebody who is experiencing substance abuse or addiction is to have a chemical health assessment done. So for those who are on, Medicaid or things like that, it's called a Rule 25. But for everybody else who has regular insurance, it's just a chemical health assessment. That being said, anybody can just call Hazelden and have an assessment done over the phone. Even a loved one can, to get a sense of what level of care they would recommend, and that can help you move forward as well. If somebody needs to be hospitalized because of an overdose or some sort of medical condition related to alcohol use or whatnot, it's extremely hard to get somebody into inpatient care, as you probably know, right from a facility like a hospital or a jail. But it's not impossible. Sometimes Hazelden can set that up, but Hazelden is not necessarily well covered by insurance, so there's a money piece there as well. So we can certainly talk about this more in person if that's helpful. If you have questions, please write them down. And I appreciate you listening, and I look forward to seeing you when we meet.